when COVID hit and nobody knew it was coming around the corner, we had to shut down a lot of our services. We weren't doing any surgeries. Radiology took a hit. So our biggest revenue generator is surgery, and we really had to shut down on that. It did have a huge impact though on the revenue stream, and so we and having to pay huge amounts of money for traveling nurses if we could even get them was very, very difficult. So we weren't able to admit anybody into our long-term care because we didn't have the people. We had to just kind of shut everything down. So we weren't doing business as usual. So when you don't do business, you don't make money. And that really hurt us. Now, we were able to capture a little bit back when we had some of the CARES Act funding that came in. And that was very helpful because it helped us with our bottom line. But when compounded with other challenges that every hospital faces, it was helpful, but and it kept us up, but it was still very, very difficult. We still struggle with getting supplies, and our biggest problem right now, obviously, is workforce shortages. People just aren't there, and that when you can't do things because you don't have staff, well, obviously that affects your bottom line. I've never believed that you can cut your way to prosperity. So while we're lean and doing everything we can, we now have the advantage of top tier buying power, which is huge. We're fighting with this 340B situation because we're not getting what we need to get. And we are a rural healthcare system and we need that help. Our community needs that 340B help. And that's quite a bit of money for us. So we're working on those kinds of things. We are after our commercial payers so that they do their job that they've said that they're going to do so that we get that money in and we can get those bills out. One of the things that I found that has been eye-opening is really involve yourself with your state's hospital association. I'm finding that is an outstanding resource. They are there lobbying for you. So get in touch with them, lobby your legislators, get as much as you can with the money that they're given and get your share of it.